The Manchester Museum and the Whitworth Art Gallery, we run a number of programmes which come under the Arts and Health banner. But I'm sure possibly a lot of you are aware that we run lots of other activities and programmes for, from pregnant mums to little tots right up to elderly, to people in the 90s. So we go across the whole spectrum of ages, and we also have lots of engagement with school groups as well. So the role that we have working with the hospital and also some of the service providers, sometimes when you're working with a different sector, it's how do you get your message out to these groups of people who are very, very busy, and they're, as we all do, we just, go steaming along with our day-to-day work. So this particular programme, just borrow this for a minute, is where we basically kind of take over the hospital, all the public spaces for a period of a week. And we don't just showcase our arts and health programmes, but we show the whole breadth of the work that we do. I always kind of think about it in these terms here. The communities of interest, the communities of people, and the communities of place. And I think by doing that, you can actually draw in lots of different diverse audiences to get your message out there to them. So as I say, we started the Culture Shots programme, and it's really an advocacy campaign about the benefits museums and art galleries and actually wider cultural organisations in the arts can have for the benefit of the patients within the hospital, but also individuals. And from the hospital's point of view, the people that work with us and the senior management, it was really important for us to get our message out to the staff. And it was about their well-being and building resilience as well, but also about how perhaps they can work with the arts and with cultural organisations to help enhance their professional practice as well. So it's like, well, how do we do and get all these interesting stories out across the health sector? And as I say, it is by putting on this week-long event. We started in 2011. It's actually part funded by ourselves. When I say ourselves, that is the Manchester Museum and the Whitworth who lead on this programme, but also the hospital do match fund with us as well. And we're actually very creative at being able to do things at very low cost budgets as well. So our main costs go on the marketing, but also on the artists that we engage on the programme as well, because it's very much the artists, and I'm talking about artists in the broadest sense, so from visual artists to poets to dancers to actors, that actually, I suppose, bring our collections alive at times. So who's involved in this? Well, everybody across the organisation, from managers and coordinators like myself, to actually conservators, to curators, our artists. But what we also do, we realise that there are lots of really interesting engagement work going on across the cultural sector within the city. So we invite other museums and also arts organisations and charities to participate. And so rather than being competitive with one another, it's about signposting who's doing all this great work. We have to think about how we design the workshops or the taster sessions, because when you're going into somewhere like a hospital, it's a very busy place. Also, it's being aware that the visitors or the staff in the hospital aren't necessarily expecting cultural or arts activities to be happening. So it's not perhaps when you're in your own organisation, such as the art gallery or the museum, where obviously visitors that come into your organisation, they've made a choice, that's what they want to do, they want to be engaged. When you take your work out into the community, people haven't necessarily made that choice to engage, so you have to work a little bit harder and use your communication skills to draw people in. It's an opportunity to disseminate our research, our programmes, in the broadest sense, as I said before. And it's also an opportunity to develop further relationships, collaborations and partnerships, not just as over the Whitworth or the museum, but for other organisations. For instance, the lady here from the Medical Museum, she's participated in the programme as well. So for any of you that perhaps work in that field and might be interested, you will find on the leaflet my email, and if you wanted to drop me an email when we do the next event, I would be happy to share the information if you wanted to come on board.